Hi everyone, a very good evening to all of you. Just give me a thumbs up. Am I audible? Good to see you all. Welcome to the session of pharmacology. Just give me a thumbs up in case my volume is all okay. All good to go? All right, fine. So let us begin now. Thank you, Dr. Indrajit. All right. So anyway, let's get started then. Just wanted to know like if all is good. Okay, fine. So I hope you guys are doing well. Studies, ups and down, all those things must be happening. It's all part of the game. It is never a smooth ride for anyone, whoever has passed this exam. Okay. It is just something that we all need to accept that there will be some days, even in the last month, that we will be feeling low. We will not be able to study, but we have to accept what it is. Nothing's going to change. Sometimes if we study, sometimes if we don't. Whatever it is, now is the time you just reconsolidate whatever you have studied, and God willing, you will be out of here very soon, my friends. Okay. If the volume seems low, let me just try another thing. Let me know if it becomes better after this. Okay. Just give me 1 minute. How about now? Do you think it's better or the first one was better? अभी ठीक है? Should we go ahead with this? All right, fine. So now first question हम यहाँ से start करेंगे. And I hope you guys score well. Now, one thing that I want to tell you before we get started, see, these questions, whatever I am going to discuss here, they may not be that level of questions that you may get in your exam. But this way, the questions that I have set will help you diagnose diseases from other subjects also. ठीक है? And anyway, the whole idea of this kind of sessions is to learn something new. We are not here just to pamper ourselves to feel better. ठीक है? These 25 questions, when you hear the lecture out, you're going to learn something. So that's all we are here for. So in case our score is good, bad, nothing matters here. Abhi, what you will be doing is you will be watching my remaining questions video also, right? The previous 2-3 sessions. 2x speed pay, please finish it off. So pharmacology ke all the 3-4 videos, whatever are there, I want you to finish them because you must have all known that by the grace of God, something or the other, at least 5-6 questions on an average are coming pretty much in every exam from that. I'm not at all claiming it's going to be ditto, same to same word, but the same topic, same kind of concepts are tested again and again. So that's why some questions we cannot cover in all, in the 25 questions itself. So that's where different topics I have discussed most of the times in each of these topics. So that's where all the 4 videos you must be watching. Okay. So that's all about this. Now let us go back. First one is better. All right. So anyway, this is my final thing in itself. So I guess you should be able to hear me clearly now. All right. So first question, now we are getting started here. A 32 weeks pregnant female develops DVT Which of the following is the best drug for the management of thrombosis? Okay, so go ahead with your answers, whatever it is. Okay, now most of you are answering it correctly. You're not leaving me any chance to explain any further. Now, there can be some mistakes that we can make here. That's why I'm just trying to make sure that before the exam, you rectify yourself in case you're doing a mistake here. Now, the correct answer to this question is going to be low molecular weight heparin. Okay, low molecular weight heparin. Let me just talk about this. So technically, even in our notes, we have said that the drug of choice for any of this venous thrombosis in pregnancy, it is low molecular weight heparins. But there can be some other alternatives also we can use. So let's remember it like this. 1 to, okay, let me just explain on the other page. So if you're talking about 1 to 12 weeks, okay, so 1 to 12 weeks, that is in the first trimester. Next again 12 to 36 weeks. All right. That is pretty much second and third trimester. And then after 36 weeks. After 36 weeks. So what exactly are we supposed to do here? So at least let's talk about these first two so that we get a good clarity. Sir, the best medicine I asked you. Okay, I did not ask you oral or anything as such. I asked you the best drug. The best medicine in both situations will be low molecular weight heparins. Okay, both situations, the answer is low molecular weight heparins. But now, in the second and third trimester, we can also use another medicine called as warfarin. Okay, so I hope that is clear to all of you. We can use warfarin as well. Next, again after 36 weeks also, whatever it is, the entire pregnancy, the drug of choice is going to be one only, that is low molecular weight heparins. That's it. If at all you want to use one oral drug, that is warfarin, warfarin can only be used in the second and third trimester, not in the first one, because we know warfarin causes some teratogenic effect, and teratogenic drugs will not be used at least in the first trimester because that's the time the organ systems are forming. So I really hope everybody understood what I said here. In the first trimester, since the organ systems are forming, you should avoid any drug that is teratogenic. You may end up using them in the second and the third trimester. Okay, so that's why now if we go back and check this, the answer here will be low molecular weight heparins. See, why did I go to this question is sometimes they may mention words like this. If you're not paying attention to the word like this, then many of you may have chosen the answer as warfarin also. Because second and third trimester, we can use warfarin. I did not ask you that. I asked you the best medicine. Best medicine. So that's where I hope you all got this clarity. Overall, the drug of choice in the entire pregnancy is none other than your warfarin. Okay. Next, second question goes here. A patient was admitted in the ER with blood pressure of 195 over 130. On taking history, the patient revealed that he has been compliant with his medication, but recently during his trip abroad, he could not take his medication as he lost his luggage. Which of the following drugs would be preferred in the management? All right, so let us go ahead. I have various answers that are coming up in this, and the options I had made are pretty much what I was expecting that many of you would answer. So pay attention, doctor. Case kya hai? What is the case over here? Somebody's blood pressure is quite high, if you notice. He has been taking medicines properly. That means compliance was okay. But in the recent trip, he could not take the medicine. That means after he stopped the medication, the BP shot up. After stopping the medication, this has happened. And I'm sure you must have learned that this is none other than the diagnosis of rebound hypertension. Rebound hypertension. Okay. So, up the question is rebound hypertension. Who causes this? The thing is, it's caused by a drug called clonidine. Clonidine, if you were using continuously, properly, no issue at all, it will reduce the BP. But if you suddenly stop the clonidine, the BP goes up. This is a medicine by the name of clonidine. Clonidine causes rebound hypertension. I did not ask you who cause. I asked you what is the drug used in the management. देखो छोटे छोटे words, small words will change the answer. I simply asked you what is the treatment of this rebound hypertension. Clonidine causes rebound hypertension, but that's not the answer. I had asked you what is the treatment, and the treatment for this is a drug called as phentolamine. So the correct answer is going to be phentolamine. Now, sir, what type of drug is phentolamine? Phentolamine is a alpha blocker, non-selective alpha blocker. So you must remember non-selective alpha blockers are very strong vasodilators. Non-selective alpha blockers are very strong vasodilators. So that's where they're used in very serious hypertensions. Another place where I would use phentolamine is a thing called as cheese reaction. Okay, और कहाँ use करेंगे? The same phentolamine can also be used in the treatment of a condition called as cheese reaction, which is caused by tyramine. Tyramine is a thing that is present in wine and cheese. So technically, this same drug can also control another BP. So let's wind it up. What are the two severe blood pressures here we are talking about? One happens due to eating something, consuming something, that is wine or cheese. It's called cheese reaction. It's a hypertension. Next, second thing is rebound hypertension. Why does rebound hypertension happen? Due to stopping a medicine. Which medicine, if you stop, it will happen? Clonidine. So all of these severe hypertensions are treated by one single drug called phentolamine. That's the answer. And last, and one more thing that I can talk about here is cheese reaction is usually seen in patients who are on certain antidepressant drugs called MAO inhibitors. Okay, MAO inhibitors, if you're using, then if you drink wine or if you eat cheese, that's the time you can expect something called cheese reaction. Okay, so hopefully everybody understood what I explained to you here. Fine. This is it. This was our second question. Again, slight challenges we need to get. Who knows, in the real exam, if they ask you a question like this, I want you to be prepared because it's a very common case scenario that they may ask you. You stopped one medicine, BP shot up, rebound hypertension, caused by a drug called clonidine, treated by a drug called phentolamine. Okay. Now let's go to the next drug. Next question. A patient is diagnosed with polycystic kidney disease. Okay. He has also been hypertensive and diabetic over the years. The patient is having edema, so the renal function test were performed and diagnosis of renal failure was made. Which of the following diuretic is ineffective in this patient? All right, doctor. Now let us go ahead to our next answer. See, first of all, polycystic kidney disease. Already, this is hinting us it may lead to renal failure. Next, he has also been hypertensive and diabetic, means again that can also lead to renal failure. So now the patient came with edema and already renal failure is diagnosed. So I have already said that this patient is having renal failure. That is the buzzword. I am asking you which diuretic is not useful in this patient. I didn't ask you which is useful. I asked you which is not useful in this patient. So now let's check this out. What should be the correct answer for this situation? Okay. Now, Dr. Saab, the first thing that you must analyze is that thiazide diuretics are ineffective in renal failure. Thiazide, especially when the GFR is less than 30, these drugs are not useful. GFR less than 30 means renal failure. So thiazide nahi kaam karti. So obviously this option is gone, right? Thiazides are not useful. And if you see our notes also, we have said that loop diuretics like furosemide, etc., they are useful in the renal failure. Okay. Now, even though this is a thiazide, okay, the correct answer is chlorothiazide. All right. So I am just telling you that even though this is also a thiazide only, but it's an exception. It's an exceptional thiazide which can actually be useful. Metolazone is the name of the thiazide which can actually be useful. Although other thiazides are not useful. Baki loop diuretics to aram se you can use. So there is no issue with that. Okay. So this is all we are saying right now. So thiazides are not useful in renal failure patients. And as you saw one thing right away, that one exceptional thiazide can work, and that name is metolazone. ठीक है. Baki, I'm sure by now you must all be thorough with what are the drugs of choice for different edemas, etc. Like cerebral edema, it is mannitol. Pulmonary edema, it is furosemide. So you know this thing. So that's why I'm not asking you those basic questions. Abhi aa gaya. This is one more, point that has been added to our vocabulary now. So let's go. Next question, sir. Okay. So the next question that we are having here is a 74-year-old man has complaints regarding his memory. He complains of difficulty remembering recent events, disorientation, and language problems. The physician makes the diagnosis of a disease whose pathophysiology includes defects like A beta plaques and tau hyperphosphorylation. Another complaint the patient has is urinary incontinence. What is the most appropriate medicine that can be used for this patient? Chaliye. See, you are also revising some important pathophysiological things, how to diagnose diseases. That's the whole aim of making this type of questions. Now, sir, old patient is there. Old patient. Next, if you notice more things in this person, he is having memory problems. If I were in your place, memory problem and old patient, it should give me a hint of Alzheimer. Yet I gave you more hints like beta amyloidosis. You are seeing that. Tau protein issues, again confirming it is Alzheimer. So let's write down first, what is the diagnosis of this disease here? It is Alzheimer disease. Alzheimer disease. This is the diagnosis that we can think about. Now, what is Alzheimer disease issue? Alzheimer disease, the reason it happens is there is damage to the cholinergic neurons, because of which acetylcholine levels are less. Acetylcholine levels are less. ठीक है? So that is the problem in this disease. Now, let's check out the drugs. What did I ask you? The patient is also having one more problem. I don't know if you paid attention to that word. The patient is having urinary incontinence. Now, incontinence patient, I want to reduce urination. My aim in this patient is to reduce urination. So how can I reduce urination? सबसे पहले you must know that if you want to reduce urination, you should reduce parasympathetic system. And this can be done by blocking muscarinic receptors, right? Blocking muscarinic receptors, you can reduce urination. So this is my aim, and this can be achieved by blocking muscarinic receptor. So sir, if you see bethanacol and physostigmine are those drugs that can actually increase parasympathetic system, so they cannot be used in this topic. They will worsen the urination. They will worsen the urination, they cannot be used. Now I'm left with two options, trospium as well as physotierodine. Trospium and physotierodine, both of them can reduce urination. ये दोनों के दोनों urination कम करते हैं. But only one can be the answer here. And the best answer in this will be trospium. Okay, the best answer here will be trospium. And the reason why it is trospium is trospium do not cross blood-brain barrier. This guy does not cross blood-brain barrier. And that is the simple thing that you need to understand here. Because it's not crossing blood-brain barrier, it will not interfere with the Alzheimer's disease, right? I hope you guys are able to understand that. That's the reason it is the best answer. Although physotierodine could also be used, trospium, since it's not going into the brain, it happens to be a safe drug in the Alzheimer patient. So I think that is all explained here. Next, moving further to our next question. A 64-year-old male presents with complaints of shortness of breath, orthopnea, and fatigue. Physical exam reveals pedal edema. History reveals chronic hypertension and diabetes. Cardiac evaluation shows the pro-BNP levels are so and so. What is the mechanism of the drug best indicated in this patient? Okay, what is the mechanism of the drug best indicated in this patient? So, क्या क्या इसमें समझ आ रहा है? So if you see person is having shortness of breath, he is having again shortness of breath when he is lying down, etc., orthopnea, and fatigue, edema. These are all straight away giving you hints of a disease called heart failure. Now, let's say you didn't know all those symptoms also. How can you know that this is a case of heart failure, sir? Pro-BNP levels. BNP levels are increased in heart failure patients, right? BNP levels are increased in the heart failure patients. So I am giving you a hint, patient is having diabetes and patient is having heart failure. So diabetes is also there, plus heart failure is there. Irrespective diabetes is there or not there. One drug was recently approved from diabetes topic, which can be used in the heart failure. I think most of you would remember that. That drug is nothing but gliflozins. Okay, gliflozins. These are those drugs that are indicated to be used in the patients who are having heart failure. Recent approval hai. I had told you this during our classes also. So make sure you know this. Now, as many of you may be remembering, one more mnemonic I used to teach you guys, glucose flows in urine, yaad hai? Glucose flows in urine. This is one mnemonic that we used to learn. And we said if you're putting too much glucose into the urine, this may actually end up causing UTIs. Okay, so genital infections or urinary tract infections is a side effect of SGLT2 blockers. Now, if you look at the other drugs also in this topic, you should be able to notice something. There is a drug. So anyway, let us mark the correct answer in this. It is SGLT2 inhibitors. Now, alpha glucosidase activity is inhibited by a drug called acarbose, voglibose, etc. Acarbose. Remember I said something? This is the drug that A for it inhibits the absorption of carbohydrates in your GIT. So that's why you may end up getting some side effects. It is a drug working in the GIT, so you must memorize some GIT related side effects. So what happens is you may get flatulence, that is gases, or diarrhea. This drug is working in the urinary tract, so it's producing urinary type of symptoms, that is your UTI or genital infections. The drug that is working in your GIT is acarbose. When you're eating carbohydrates, you're not able to absorb them. It's a drug working in GIT, hence the side effects are also GIT related. Next is the drug that increases PPAR gamma. These are drugs, glitazone. Okay, glitazone. Glitazone are drugs like rosiglitazone, pioglitazone type of drugs. Now, if you remember, these are those drugs that are contraindicated in heart failure. They are contraindicated in heart failure. You're not supposed to use glitazones in the heart failure patients. Okay. Next and the last thing, the drugs that are inhibiting the ATP sensitive potassium channels. These are drugs like glimepiride, gliclazide, etc. Okay, so sulfonylurea type of drugs, sulfonylurea type of drugs. These are those drugs that are having the name GL in their beginning, right? Their names start with the GL and they end with the ide. And we had the mnemonic I decrease glucose, I decrease glucose. So these are those drugs that can actually cause hypoglycemia as a side effect. Hypoglycemia as a side effect. Okay, so that's it. ये चार पांच drugs है. Diabetes is obviously a very potential topic, so we have discussed the most important drugs from this already. Okay, now chaliye, that's all. I hope everybody understood. In case you didn't answer this, now you know that if they give you one line, two line, whatever it is, now when you do the difficult part, then you will have this clinical picture in your head now. You will know that diabetes and heart failure, or simply heart failure, which diabetes drug is indicated? Answer is gliflozin. Gliflozin. Okay. Next, dosto, let's move on. A patient was given adrenaline injection for the treatment of anaphylactic shock, and the drug X was also given for some other reason, following which the patient developed profuse hypotension. Identify the drug X. Okay, identify the drug X. Okay, so let's go ahead. क्या case है? What is this case describing? Let us check this out. A patient was given adrenaline, buzzword. Adrenaline was given for anaphylactic shock. Obviously, we know it is the drug of choice. Next is, if you're talking about profuse hypotension that is happening after giving adrenaline, how is this possible? अच्छा, सबसे पहले let's try and understand some basics here. Let me explain. If you talk about the medicine called adrenaline, if you talk about adrenaline medicine, adrenaline works on a receptor called alpha 1 receptor, which causes vasoconstriction, and it also works on beta 2 receptor that causes vasodilation. Okay, it works on both alpha 1 also, beta 2 also, vasoconstriction and vasodilation. So many of us will say, sir, BP should be neutral only with adrenaline. Why does the BP increase with adrenaline? Because alphas dominate. You need to remember, alphas dominate. That's why the net effect is the BP will increase. Now, because adrenaline increases BP, it is used in a shock called as anaphylactic shock. So if you give adrenaline alone, what is going to happen? BP increases. BP increases. Now let's say you're giving adrenaline to somebody. Same BP increase should be expected. Same BP increase should be expected. But let's say another drug was given along with this. If you give one alpha blocker with this drug, let's say adrenaline was given, another drug that was given as alpha blocker. Now the alpha receptors cannot work. What is the only receptor that is working in the body? Only beta 2. And what does beta 2 do? Vasodilation. And what will vasodilation do, my friends? It will reduce BP. That is nothing but hypotension. This is what is called vasomotor reversal of Dale, right? This is what is called as vasomotor reversal of Dale. Now pay attention. What is the question I have asked you? I said a patient was given adrenaline for some reason, anaphylactic shock. Then another drug was given. After giving another drug, the BP reduced. So I asked you which drug was given. The answer is alpha blocker must have been given. That's why the BP went down. So now let's try and figure out which is the alpha blocker. Oh, the answer is already highlighted here. The answer is phentolamine. We have already talked about phentolamine earlier, right? So phentolamine is used for cheese reaction treatment as well as rebound hypertension treatment. Tamsulosin, if you talk about tamsulosin, it is alpha 1A blocker. So tamsulosin or another drug called as silodosin, these are the two drugs. They don't cause any hypotension because they work only on the prostate area. They don't work on the blood vessels. So tamsulosin or silodosin, they are the drug of choice for those patients who have only one disease called BPH. They are very selective. They are very selective on your prostate. That's why they are the drug of choice for the BPH patient. Okay. And assuming if the patient is having two diseases, that is BPH plus hypertension also, BPH plus hypertension, then I'm going to use alpha 1 blockers like prazosin. Okay, alpha 1 blockers like prazosin. This is what's going to be used here. I hope everybody got this much. Baki, formoterol is a beta agonist. Atropine is a muscarinic blocker. So other guys has no effect here. So straightforward. Now I hope you are able to catch this question. Adrenaline alone increases BP, but adrenaline plus alpha blocker, if you give, BP reduces. And I just asked you what was that drug X that was given because of which BP went down. The correct answer is phentolamine. Phentolamine. Okay. So that's it, sir. Let us move on to this. A patient complains of muscle weakness that becomes progressively worse towards the end of the day and improves after periods of rest. Physical exam was performed and ptosis was noted in this patient. What is the mechanism of the drug used for the diagnosis of the patient? All right, my friends, I hope you're ready with your answers already. First thing, Daksha, most of you must have already figured out that this disease that I'm talking about is myasthenia gravis. Myasthenia gravis. Okay. Now, if you're talking about myasthenia gravis, you must remember that the treatment that I'm going to give you here, it is the drug that is acetylcholinesterase inhibitor, the drug like stigmates. Okay. Now, what do these drugs do? Let's check this out. See, this is my acetylcholine. You all know acetylcholine may break down because of one enzyme called as acetylcholinesterase. So if acetylcholinesterase is present, acetylcholine breaks down. So if you block this enzyme, acetylcholine levels will increase because of the medicine. And once acetylcholine levels increases, now what will happen is that it goes and works on certain receptors. One receptor is muscarinic receptor. Another receptor is nicotinic receptor. So two receptors here, one is muscarinic receptor, another is nicotinic receptor. Now, sir, you must remember that I wanted nicotinic receptor to work because nicotinic receptor will cause skeletal muscle contraction. Myasthenia patients have excess muscle relaxation because of which the eyelid droops called as ptosis. Okay, muscle relaxation is seen in myasthenia. So my aim as a doctor is to contract the muscle. So how will I contract the muscle? I need to increase the nicotinic effect, NM receptor effects. So I am blocking acetylcholine, which increases acetylcholine, and now this will cause skeletal muscle contraction, which I wanted. But sir, there will be a problem. Because you increased acetylcholine, this acetylcholine will go and work even on muscarinic receptor. This becomes side effect. This becomes the side effect. So what we are going to do is, I will give you first one medicine that blocks acetylcholinesterase. This will increase acetylcholine. It will cause muscle contraction. But exactly at the same time, I will add another medicine in your treatment. What am I going to do here is, I will be blocking this muscarinic receptor by a drug called atropine. Atropine is only going to block muscarinic receptor. So why is this drug given? Atropine is given simply to reduce the side effects. Otherwise, it does not have any role in myasthenia gravis. You gave treatment, your treatment caused side effect, and now you're treating your side effects. Okay? I hope everybody understood this, why atropine is added whenever you give some stigmine type of drug. Hope you understood this logic. Okay, sir. So anyway, I asked you the question. What did I ask? Okay, mechanism of action of the drug used in the diagnosis. By the way, what is the drug that we use in the diagnosis of myasthenia gravis? We all must be knowing the diagnosis is done by one drug called edrophonium. And edrophonium happens to be, the drug we use in the diagnosis. And this test is known as Tensilon test. Okay, in medicine we call it as Tensilon test. Finished. Next question, my friends. A 25-year-old male presents with painless lymph nodes, fever for no known reason, weight loss and fatigue. Biopsy was performed and Reed-Sternberg cells were found positive. Patient was started on chemotherapy and later developed bone marrow suppression. Which of the following drugs can be used to increase the WBCs? Okay, so let's go. Let's discuss this question. Number one, a patient is having weight loss without any reason. Weight loss is happening, fever of unknown reason, etc. All this are certain signs of cancer. RS cell was found. RS cell, Reed-Sternberg cell, I'm sure you know it looks like the owl's eye. So this one happens to be the diagnosis of Hodgkin's lymphoma, right? Hodgkin's lymphoma. So obviously a chemotherapy must have been started. And after the chemotherapy, the bone marrow suppression took place, the side effect of certain anti-cancer drugs. Now the question is, what needs to be done? By the way, Hodgkin's lymphoma, we give one medicine called vinblastine in this, and vinblastine is a drug that causes bone marrow suppression. Vinblastine causes bone marrow suppression. आपको याद रखना है, it blasts the bone marrow. Vinblastine blasts the bone marrow. So how will you increase WBC was my question. First, you must know that WBCs are called granulocytes, right? And there are some of them that don't have granules. They are called agranulocyte. Example of a cell which does not have a granule, or it's called agranulocyte, is called monocyte. Now, if you actually pay attention to the name of the drug, sargramostim has gra for granulocyte, mo for monocyte, and stim word is for stimulation. So this drug is very clearly telling us that this is nothing but granulocyte monocyte colony stimulating factor. So the correct answer for this topic will be none other than your sargramostim. Although the other drugs are also used in bone marrow suppression, but not for WBC. My question was, WBC, how do you increase? If they ask you how do you increase RBC, then the answer is darbepoetin. See, look at the word darbepoetin, sounds like erythropoietin. Erythropoietin increases the RBC. Same like that, darbepoetin. Next you have thrombopag. Thrombopag means what? Thrombocyte agonist. Thrombocyte agonist. Okay, so this drug is for increasing platelets. Thrombocytes agonist. Next, oprelvecin also increases platelets. It also increases platelets. Now, how does oprelvecin works? Oprelvecin is an interleukin 11 drug. Interleukin 11 is required for platelets. So this name only, if you change little bit, spelling you can just change like this, and you can remember oprelvecin, where you get the number 11 kin. Okay, 11 kin. That's it. So ye drugs, they are for the platelets. I hope everybody understood this. Okay. Next, sir. That's all. Again, I'm repeating the whole aim. The whole aim of this session is to learn some things. Make as many mistakes as possible. Right? It's all fine. Let's prepare ourselves for the final battle. Today you make mistakes, you are excused. No problem at all. Okay? If you're not making any mistakes, then that's dangerous. The only man who never make mistakes is the man who has never done anything. If you're doing something, mistakes will happen, and you should learn from those mistakes. If you're repeating the same mistakes, then you haven't learned anything. आज अगर हम गलती करते हैं, then you should be memorizing that, okay, this is something I should not mess up in my real exam. And let's say this comes in your exam tomorrow, anything from this session or my previous session, then if you're not repeating a mistake, then you are a winner. Despite giving you so much selected things like 25 questions, from that also, if you're still making same mistake despite watching, that means you're not learning properly. तो इसको ढंग से देखना है, take it seriously, and God willing, something or the other must be helping you in your real exam. Okay, that's my whole intention here, my friends. Okay, next, getting to the next question. A patient presented with complaints of productive cough for last 25 days along with fever and chills. Sputum was collected that shows acid-fast bacilli, AFB means acid-fast bacilli, and gene expert shows RPO-B gene mutation. Finally, the patient was started on the recently approved regimen for the same. Which of the following is not included in the regimen? Okay, so let's check this out. What is this? First thing is that acid-fast bacilli is given. Right away, TB you should start thinking. Gene expert word came, again hint of TB. Gene expert is nothing but a PCR. So this is detecting one mutation called RPO-B gene mutation. If this mutation is positive, that means the drug called rifampicin is resistant. Okay, rifampicin drug, if it is resistant, then that means RPOB gene mutation is present. So let's assume since rifampicin is resistant, there is this TB called MDR TB. You must be knowing in MDR TB, two drugs do not work. H plus R, isoniazid and rifampicin. Isoniazid plus rifampicin, they do not work. They do not work. So what are we going to do in this? A new treatment has been approved that we all must have heard, right? This got, released, somewhere in the mid of the session. So maybe in my previous classes, when I might have told you MDR TB treatment, it might have been different. But now it is a new treatment that was approved later on. So B-PALM regimen is the latest regimen. I just asked you in this regimen, which drug is not included? सबसे पहले the drug B stands for bedaquiline. Okay, the B stands for bedaquiline. Bedaquiline is a drug that inhibits ATP in the TB. Okay, next P. P stands for pritomanid. P stands for pritomanid. This is a drug that inhibits mycolic acid. MA, you should be remembering, it inhibits mycolic acid. Next, A is not a separate drug. So Astronom is not the correct answer. I mean, it is the correct answer, but it's not included in the regimen. L for linezolid. This drug also is there, linezolid. Linezolid is a protein synthesis inhibitor drug. It works on the ribosome, that is 50S ribosomes. And M stands for another medicine which I did not write here. It is called moxifloxacin. So now you must know what is the B-PALM regimen. This is a short course treatment. Again, it is claiming that it can treat multiple drug resistant TB, multi-drug resistant TB in 6 months. So what is this regimen? Let's repeat. Bedaquiline for B, P pritomanid, L linezolid, M moxiflox or moxifloxacin. That's all about this, sir. Next, let us go ahead with our next question. A 57-year-old male hypertensive patient with chronic diabetes presented with fever, edema on feet and face, fatigue, nausea, and vomiting. He admitted that he was non-compliant with the medications. Cardiac evaluation reveals ejection fraction is 58 and renal evaluation shows GFR value is less than 30. All of the following medicines need to be avoided except. So I think smart enough, you can quickly figure out few things. Patient is having BP and sugar for a very long time. Obviously that itself is indicated of maybe heart failure or renal failure also. Now, if you see the patient was not using medicines properly, he was non-compliant with his medications. Cardiac evaluation was done and cardiac evaluation reveals ejection fraction is 58, meaning it's almost close to normal only. Yes, it may be slightly less, but it is almost close to normal only. So heart function in this person is pretty much good, but kidneys are gone. If you see GFR is 30, that means the person is having renal failure. Now, since he is having multiple diseases, I have given you options from multiple diseases, and these are those drugs that needs to be avoided in renal failure patients. In my previous MCQ, we learned thiazides cannot be used in renal failure. So thiazides cannot be used for hypertension in this patient. So one option gone already, they can't be used. Metformin, the drug of choice for diabetes. If you see our notes, metformin is again contraindicated in diabetic patients because of risk of lactic acidosis. Lactic acidosis. Now, if you see gentamicin, gentamicin is aminoglycoside. Gentamicin is aminoglycoside antibiotic. And you must know aminoglycoside N and O. N for nephrotoxic, O for ototoxic. Since these drugs are nephrotoxic, obviously I will not be using them in the patient of renal failure. I'm left out with only one option now, that is ceftriaxone. The correct answer in this is ceftriaxone. Now, when I said ceftriaxone, let us just remember something. There are some drugs that are not excreted directly by the kidney, but rather through the bile. Okay? That means they will be safe in the renal failure patients. So what are these antibiotics that we must know that are safe in renal failure patients? Okay. Now let's remember one mnemonic. The antibiotics that are safe in renal failure, safe in renal disease. Okay, safe in renal disease. So what are these antibiotics? Now safe means Ceph. Safe means Ceph. That is cephalosporins. The cephalosporin that you must know just now we studied is ceftriaxone. Ceftriaxone. This is safe in renal failure. Next, if we talk about rifampicin, rifampicin. Next, erythromycin, erythromycin. Next, a penicillin like nafcillin, nafcillin, ampicillin, ampicillin, lincosamide, lincosamide class, especially clindamycin example. Next, doxycycline, doxycycline. So these are all the important antibiotics that are safe in renal failure patient. So our option had ceftriaxone, so that would be the correct answer in this. So I hope everybody understood this, friends. So this was the correct answer because the patient was given a clinical history of renal failure, renal failure. Okay. Except was the word, my friends. These are words that you need to pay attention to. Okay. All set to go. Next, a patient was admitted due to palpitations, shortness of breath, chest pain, and vomitings. ECG showed tall T waves or peaked T waves. I think the moment you saw this, even if you don't know the signs and symptoms, if you saw peak T waves, you must have figured they're talking about hyperkalemia. Hyperkalemia. All right. Now the patient was started on IV salbutamol. See, friends, I don't know if you remember, salbutamol, everybody will know that it's a drug used in asthma. So that's not a very big thing to memorize. You should know that beta-2 agonists like salbutamol, they reduce potassium levels. That's why they can be used in the treatment of hyperkalemia. I repeat, salbutamol reduces potassium level. That's why it can be used in the treatment of hyperkalemia. So I'm just saying the drug called salbutamol, which happens to be a beta-2 agonist. I said all of these are side effect except. All of these are side effect except. So sir, you must remember that tremors is a side effect. One of the commonest side effect of salbutamol like drugs is tremors. They cause palpitation, yes. They reduce potassium, that's why they're used. That's why they're used in the hyperkalemia. Question was asking again, except. So hypertension is not caused by these medicines. Okay, hypertension is not caused by beta-2 agonist. That's why this becomes the correct answer. Okay, so I hope everybody is clear. Apart from this, if you remember, in this patients, we are also going to use insulin plus glucose. Insulin plus glucose. Fine. Go ahead with your next question. A 45-year-old man presented with recurrent episodes of headache, palpitations, and sweating. His blood pressure at presentation was 180 over 100. Further testing revealed elevated urinary metanephrines, CT abdomen showed a right adrenal mass. What is the drug of choice for the management of this patient? Okay, so I hope you're all able to understand this. See, as usual, in every case, we are first writing the diagnosis most of the time. If you're seeing right adrenal mass, metanephrine levels are increased, BP is high, palpitation, sweating, all these things are giving you a hint for a disease called pheochromocytoma. Okay, pheochromocytoma. Now you must remember in pheochromocytoma, the first two words themselves become our mnemonic. P for palpitations, you can remember. H for hypertension, you can remember. Palpitation and severe hypertension. Apart from that, H for headaches also. So palpitation, hypertension and headache, these are the markers for your pheochromocytoma. Adrenal mass, as you know, it's a tumor of adrenal medulla. Adrenal medulla produces catecholamines. When you're producing too much catecholamines, they cause increase in the heart rate, they cause increase in the BP. Now, if you're having too much catecholamines, they will break also extra. If you're making too much of something, then metabolism also increases. So what happens because of this? There are some things called metanephrines. The breakdown products, they will also increase. आप कोई भी चीज पैदा ज़्यादा करोगे तो obviously its waste products will also increase. So metanephrines are increased. That's why this is pheochromocytoma. Now you must know what is the treatment that needs to be given here. Then the answer is going to be phenoxybenzamine. Phenoxybenzamine is once again an alpha blocker, which is non-selective alpha blocker. Non-selective alpha blocker. That's what is going to be used here. Phentolamine was also a non-selective alpha blocker which we used in cheese reaction and rebound. Nitroprusside is a drug we use in hypertensive emergencies. Labetalol also is a drug we use in hypertensive emergency, especially in the pregnancy. Especially in the pregnancy, we will be using labetalol as the drug of choice, both in PIH as well as emergency. Okay. Oh, this is the issue we are facing. Okay, I'm gonna zoom out only for this question. I asked you identify the best correct option. Okay, identify the best correct option. I guess you should have your answers by now. So, gentlemen, the first thing that you should notice is there are three things you need to pay attention to. You cannot just look at one or two things and mark the answer. The correct answer from all of this is actually the option D. Okay. Why would option D be the correct answer? Because the drug spironolactone, it is the drug of choice for cirrhotic edema. Yes. It's also the drug of choice in Conn syndrome. And it's also used in resistant hypertension. Now, gentlemen, this is the drug that works in the collecting duct. It works in the collecting duct. So that's why this is the correct answer. Acetazolamide, yes, it is used in mountain sickness, but it does not work on DCT. It works in PCT, sir. It works in the PCT, so it's wrong. Next, if you see chlorthalidone, what is chlorthalidone? Chlorthalidone is a thiazide diuretic. It is a thiazide diuretic. Thiazides are not indicated in cerebral edema. You all know cerebral edema, mannitol is used. And if you see the thiazide diuretics, they work in DCT. They work in DCT. So ये भी गलत है, ये भी गलत है. Both things are wrong. Next, mannitol. Mannitol is working in PCT. This part is correct. It is working in PCT, but it's not indicated for pulmonary edema. It is used for cerebral edema. So that's where the best option from all this four, it is going to be none other than your option D. Okay. Next thing, a 2 months pregnant female presented with Plasmodium vivax malaria. Which of the following is the most appropriate treatment for this patient? Okay. Anyway, I apologize, like in certain questions, the answers by mistake they got already marked. But again, you need to have like very sharp eyes to actually look at those. I am unable to make out like that option is the marked one, but still आप लोग की आंखें तो माशाल्लाह होती है. Now, this is the correct answer, chloroquine. Let me explain a couple of things to you. All right. Here we go. First, if we are talking about Vivax versus falciparum, Vivax versus falciparum, you must remember the treatment that needs to be given for these people. In pregnancy goes like this. In Vivax, entire pregnancy, I'm going to give only one drug called chloroquine. Chloroquine. This is it. Whereas falciparum, on the other hand, first trimester, we need to give the drug that is quinine. First trimester mein, we are going to give a drug called quinine. Second and third trimester, then we should be moving on to something called ACT. ACT, artemisinin combination treatment. And you all know the artemisinin combination treatment is different in northeastern states of India and remaining parts of India. Okay, so please make sure you remember this. Vivax, the drug is chloroquine throughout pregnancy, there is no issue. Whereas falciparum, the drug of choice will be quinine in the first trimester. Second and third, it is ACT. ACT. Okay? Now, let's say somebody is not pregnant. You're just talking about the normal treatments of these people. What should you be doing is, for Vivax, again, the drug of choice is chloroquine. Chloroquine happens to be the drug of choice for Vivax. But for falciparum, the treatment is going to be ACT. Okay, the treatment is going to be ACT. So, आपको याद रखना है one mnemonic, very cool fact. Okay, we are going to remember the mnemonic, very cool fact. Vivax, we give chloroquine. Falciparum, we give ACT. Very cool fact, you must know. Now, Doctor, you must also be knowing from your microbiology that Vivax will be having one extra stage that is called hypnozoid that will cause relapse. Okay, this guy will cause relapse. So we will talk about that. But before we get there, how does malaria come into human beings? If you remember, there is a stage called gametocyte. Gametocyte is one stage that is present in both the organisms. Now, to kill the gametocyte, we need to give single dose of a drug called primaquine. देखो, primaquine is contraindicated in pregnancy. I'm not talking about pregnancy. I'm talking normal people right now. So gametocide, if you kill in the human being itself, mosquitoes will not get affected. And if mosquitoes won't get affected, then humans in return will not get affected. So single dose of this must be given. Single dose primaquine is given to kill the gametocides of all species. Next, in Vivax, there is something extra. What is extra stage that is present in Vivax? It also produces one extra stage called hypnozoid, which actually causes relapse of malaria. Hypnozoid causes relapse of malaria. So for this, we need to give either the new drug called tafenoquine, which is given in a single dose, or you can give primaquine for 14 days. 14 days. Please make sure you remember each of this has a separate purpose. Now, to treat malaria, basic drugs are these only. Very cool fact. Next, to prevent the transmission into mosquito, you have to add a single dose of primaquine. And if you want to kill hypnozoids, that is to prevent the relapse, then you will be giving tafenoquine single dose or primaquine 14 dose. 14 days. My bad, sorry. That's it. तो अच्छे से याद रखना इसको. मलेरिया पे as you know questions are repeated, so that's why I have given you this. Next. So I think we have already marked the answer for that question over there, so that's why I'm not going back again. Now guys, go ahead with this. A 27-year-old female was admitted to critical care due to a drug overdose as she was trying to commit a suicide. An IV infusion of sodium bicarbonate is administered as a part of treatment plan. Which of the following drug would be the causative agent for this condition? Okay, so let's go ahead with your answers. I can see many of you are answering good. ठीक है, चलो. See, the whole idea is maybe some places by mistake the answers are marked also, but again, we are not here to cheat. If you are understanding the question, then I guess without that help also you can still answer this correctly. ठीक? So first, somebody was trying to commit a suicide. We may not be knowing which drug was taken by the person for suicide. We started the treatment with sodium bicarbonate. Bicarbonate is what? Bicarbonate is a alkali. You all know, when we don't know who is the drug that was ingested by the patient, we start something called alkaline diuresis. We start alkaline diuresis. Alkaline diuresis is done for those drugs which are acidic in nature. Okay, simple, sir. For acidic drugs, opposite is done called alkaline diuresis, and for alkaline drugs, acidic diuresis is done. So in the question, it's already said, we as doctors have started sodium bicarbonate, meaning alkaline diuresis was started. That means the patient must have ingested something called acidic drug. So from this 4 drugs, which is acidic, let's try to understand. See, any drug having ene in the name is alkaline drug. Alkaline drug के नाम में क्या होगा? Ene, because the word alkaline itself has ene in the name. So these are alkaline drugs. For alkaline drugs, you will not do alkaline diuresis. So obviously they cannot be the answer. Now I'm left out with aspirin and opioids. Aspirin actually comes from salicylic acid. Salicylic acid. So if you see any drug having 8 in the name, 8 means a acid. 8 means a acid. Folic acid is called folate. 8 means acid. So salicylic acid drug, it's nothing but an acidic drug. Barbiturate, drugs like phenobarbital, then all nothing but acidic drugs. So how will you remove acidic drugs from the body? Since some of them don't have antidote, you're going to do something called alkaline diuresis. Okay. Opioids are those medicines we have a antidote called naloxone. Okay, opioid ka antidote will be naloxone. So that's it, that you must remember. तो इसका सही आंसर, द करेक्ट आंसर फॉर दिस इज डेफिनेटली एस्पिरिन दोस्त. नेक्स्ट, a 10-year-old boy was rushed to the emergency department. Physical exam shows mydriasis, flushing, dry and hot skin. The boy also complained that he has not been able to pass stool or urinate. The parents informed that while playing outside, he ate something that looked like a fruit. All of the following may be present with similar symptoms except. Okay. Benzodiazepine examples are diazepam, lorazepam, alprazolam, midazolam, these names. Okay. Chaliye. So again, some of you are messing up the question. Okay. कोई बात नहीं. This is the place where we are here to again learn. चलो देखो. What did I ask you in the question? The patient is having mydriasis. Mydriasis means either it could be something that can increase sympathetic system, or it can be something that can be reducing parasympathetic system. ठीक है. Now look at the other things. The patient is also having flushing, redness on the face, dry and hot skin. You all know if you reduce parasympathetic system, sweating is also blocked. Muscarinic receptors, if you block, sweating gets blocked. And if sweating gets blocked, your body temperature increases. That's why you are having this hot skin. All the secretions are less. That's why your body is dry. That means this is nothing but a presentation of anticholinergic symptoms. Reducing parasympathetic system will produce all this. Opposite of dumbbells. Opposite of dumbbells. Now I asked you, all of the poisons which I mentioned here can do these things except. That is my question. I didn't ask you a diagnosis. So for those of you who are marking Datura, then even belladonna does the same thing. Even atropine does the same thing. So sir, at least, you know, those people who have attended my classes must be knowing I teach you one mnemonic that is bad. Bad. What is bad? Belladonna, atropine, Datura. They all present the same way. That means they reduce parasympathetic symptoms. They all present the same way. And now to treat this people, we give one medicine called as physostigmine. Okay, physostigmine is the treatment. It's not causing this problem. What does physostigmine do? It increases parasympathetic. Physostigmine क्या करता है? Opposite. It will increase the parasympathetic. These poisons are reducing parasympathetic, and physostigmine will increase it back. That's why physostigmine is the antidote for these things. Everybody okay with this? ठीक है. छोटी मोटी चीजें, some things that we might be we tend to forget. We are revising all of those important parts here. Next, all of the following drugs have mydriatic plus cycloplegic action except. All of the following drugs have mydriatic plus cycloplegic action except. So you must know something here. Let us try and understand this. Sir, first of all, if you talk about the eyes, if you are talking about the eyes, you must keep in mind there are two systems. Parasympathetic system, it produces two things on the eyes, meiosis plus another thing on the ciliary muscle, which will be producing a thing called accommodation reflex. Parasympathetic system works on two places in the eye. One is in the pupil, second is in the ciliary muscle, and this will cause accommodation, ciliary muscle contraction. Next, we have another guy called sympathetic system. Sympathetic system works only on one part of the eye, that is pupil. And what it does is it produces mydriasis. It produces mydriasis. Now, you all must be knowing that mydriasis is used for fundoscopy or ophthalmoscopy or retinoscopy, whatever you call it. Basically, for eye exam, I need to dilate the pupil so that I can see more easily, right? So, mydriasis ka use ye hota hai. This is why we use mydriasis. So, sir, parasympathetic, though it's causing meiosis and accommodation. So, what do? We block parasympathetic system. And if you block parasympathetic system, now you will get exactly opposite effects. You will get mydriasis, plus you are also going to get opposite effect of accommodation called cycloplegia. Opposite of this called cycloplegia. So, अब I have two types of drugs who can produce mydriasis. One is parasympathetic blockers who can produce mydriasis plus cycloplegia, whereas sympathetic drug will only produce mydriasis. Now, if you remember the mnemonic I taught you during my classes, cat drugs. Cat drugs produce both mydriasis as well as cycloplegia. Now, who are the cat drugs? Let's check. Cyclopentolate, atropine, and tropicamide. These are the three drugs which produce both mydriasis and cycloplegia. Again, the question is except. What is the correct answer here is phenylephrine. Phenylephrine. Phenylephrine is a sympathetic drug. It's an alpha-1 agonist that will produce only mydriasis. Okay, so that was the answer for this, dosto. Next, a new drug treatment is undergoing clinical trials. In which of the clinical trials dose ranging is done? Okay. In which of the clinical trials dose ranging will be done? That is the question. Looking at your answers. Good. Rodis ka salam aap sabko. I am glad that majority of you caught the tricky point I have introduced there. Very good, dosto. See, I had given one word, dose ranging here. Dose ranging here. The correct answer to this is phase 2. Phase 2. Okay. Now, look at this. If you're talking about the actual main trials, they will be phase 1, 2, 3, 4. Okay, ये main वाले होते हैं. Apart from this, there are some others also. So I would like all of you to just pay attention to the first 4 phases only, these 4. Okay, forget the phase 0 also, just look at these 4 ones. Phase 1, phase 2, phase 3, phase 4. Now, if you're talking about this, what I'm saying is phase 1, what is the basic purpose of this? Okay, what is the basic purpose of this? You all must know that phase 1 is not done in patients. It is done in healthy volunteers. Phase 1 is done in healthy people. Since it is done in healthy people, we cannot check the efficacy of a drug. If the person is not even having the disease, how am I supposed to know which is the effect or which is not the effect? So, sir, what do we check in this is only the safety of a drug. The first thing in the phase 1, the priority is to check the safety of a drug. Okay, so I hope this is clear enough to all of you. Now, this is to test the toxicity or safety, where we check the maximum tolerable dose by human beings. Now, unless it's anti-cancer drugs, this phase also must be done in patients. Okay, this must be done in patients. Otherwise, because cancer drugs are more toxic drugs, otherwise for the other diseases, we should do it in normal healthy people. Now, next is second, therapeutic exploration. Now, this is the first time I'm checking if my drug works clinically or not. So I am checking for the efficacy. I'm checking first time for the efficacy. It's not confirmed yet. It may work, it may not work. So first time I'm checking for the efficacy. First, is this okay? And next, because I've already checked maximum dose kitna de sakte hain, now in the patients, this one is done in the patients for the first time now. So this is the place where I will check what is the dose in which this drug can actually treat this disease. So dose ranging will be done in the phase 2. Toxic dose matlab maximum tolerable dose, in which phase are we analyzing? First phase. But the dose which is given to the patients for the clinical effects will be checked in the phase 2. Dose ranging isko bolte hain. Next, phase 3 is confirming the efficacy. This is done in more number of people where we are confirming the efficacy. And last and the final, phase 4, after the drug is approved, etc., the drug will come into the market, but still we will keep our eyes on the drug. This is called phase 4 or post-marketing surveillance. Now, if I am checking the drug for a very long period, what is going to happen? Now I will get to know the long-term side effects or rare side effects of the drug. So phase 4 may, what is called as post-marketing surveillance, will get to know the long-term or rare side effects. So this is it. Now we have just talked about the clinical trials right here. Now is your next question, sir. A 44-year-old female presents to the clinic with history of 17 days of fever. Now, since last 2 days, she has pain and burning sensation while she pees, and her urine frequency has also increased. She was using NSAIDs to reduce fever. Which group of drug is most specific for the healing of NSAID-induced ulcer? Okay, so let's go for the answer. The correct answer to this question is option A. Option A. All right. Now try to understand what is this. यहाँ पे most of the time we end up making mistake. That's why I've given you this question. Sir, check this out. Let's assume this is a mucus layer in somebody, mucosa layer. This mucus layer is actually made by prostaglandins. Prostaglandins give you protective layer, right? Prostaglandins are those that make this protective layer for you. So what I'm telling you is this. Imagine somebody is using the drugs. Somebody is using the drugs called NSAIDs. Now, what do the drugs NSAIDs do? They reduce prostaglandin. Because the prostaglandins are reduced, this ulcer has happened here. The cause of the ulcer is reduction in the prostaglandin. You lost this, protection. Now what will happen is that acid will come, and when it goes through the ulcer, it touches the inner parts of your layers there, and it causes pain. So pain kaun karta hai? The pain is due to this acid. Okay, the pain is happening due to acid. So now you have 2-3 things here. Now the first thing is, what is the best thing to do to reduce this ulcer pain? If they ask you what is the best drug for any ulcer, I don't care, gastric ulcer if you're talking, whether it's due to H. pylori or due to NSAIDs, I don't care. The answer is reduce this acid. If you are reducing this acid, then the pain will reduce. So best medicines are PPIs. Best medicines are PPIs. No wrong answer in that. But now check. If they ask you what is the specific drug that can be given, specific means you should say what is the cause of this ulcer. Ulcer हुआ ही क्यों सबसे पहले? The ulcer happened because of reduction in the prostaglandins. So don't you think the treatment of this should be to increase the prostaglandins back again? यही reason है ना ulcer का. This is the specific reason. So how do you treat that specific reason? Increase the prostaglandin. Best medicine PPI. Most specific medicine is misoprostol. So if you check here, this is a drug called misoprostol, the most specific drug. ये एक word answer बदल देगा. This is the same thing. Okay, so what I'm saying is that this misoprostol is the most specific drug, but the best medicines are PPIs. I didn't ask you best medicine there. I asked you most specific drug. That's why the answer is this. ठीक है, एक वर्ड में पूरा आंसर बदल देगा. Go ahead, sir. Next, a patient is undergoing leprosy treatment and develops hyperpigmentation of skin. Which of the following drugs can actually do that? Which of the following leprosy drugs can do this? Okay, the correct answer to this is option B, my friends, clofazimine. Clofazimine. This is the thing that you must all keep in mind when it comes to this. So please check what I'm telling you next. Doctor, first of all, the treatment of leprosy is three drugs that is called DRC, that is dapsone, rifampicin, and clofazimine. These are the three drugs that we are going to use, and same drugs are used for both mild leprosy, what you may be learning as paucibacillary leprosy, and the more severe leprosy called lepromatous leprosy. So this is mild disease, paucibacillary. Pauci means less bacteria. Lepromatous leprosy has too many bacteria. Severe leprosy. दोनों में same ही drug use होते हैं. And one of this drug called clofazimine, this is the one that causes hyperpigmentation. And it also causes dryness on the skin, giving you scaly-like lesions called ichthyosis also. Okay, so that's about this. Baki, rifampicin causes reddish orange colored, secretions, etc. That's what we may be knowing. So बस इसमें से ये एक specific something random, if they ask you, I wanted you to know this. So clofazimine याद रखना है. This is the one that causes color changes. ठीक है, color changes. Next. I hope this one you will mark correctly, friends. A patient who was admitted in ICU was given penicillin for the treatment of gram-negative infection. Next, which of the following drugs can be used if the patient is having penicillin allergy? Okay, penicillin allergy. All right, so let's go. It's not a very difficult question. Hopefully you guys got this correct. The correct answer to this, any guesses, sir? It is astrionam. Okay, the correct answer to this will be astrionam. Chalo, let's try and understand this. Now you must remember that the drugs called cell wall inhibitors. Cell wall inhibitors, they are of two types. Okay, so what are the two types of cell wall inhibitors? Check this out. One of them is called as beta lactams, and another one is called glycopeptides. Beta lactams and glycopeptides. Beta lactams, there are drugs like penicillin, cephalosporin, carbapenems, and monobactam, that is known as astrionam. And in the glycopeptide, you have a drug called vancomycin. Vancomycin. Now, you must remember that structurally, penicillin, cephalosporin, and carbapenems, they are similar. In the structure, they have something called rings. They have two rings, whereas monobactam, the name is mono, it has only one ring. It has only one ring. So if you are having penicillin allergy, pretty much other beta lactams also must be avoided. All these beta lactams must be avoided. The only beta lactam that can be used is astrionam or monobactam. Okay, is that understood what I said here? Penicillin, cephalosporin, carbapenem, they will have cross allergy, they cannot be used. So we have to go for monobactam or astrionam. I can use vancomycin also because it's not a thing. So your doubt must be here. Your doubt must be, sir, vancomycin also could be a possibility. Why did you say the answer as astrionam? Now, let me just tell you this. There was one more thing being mentioned here, gram negative. Astrionam works only for gram negative organisms. Only for gram negative organisms. Vancomycin is more effective for gram positives. Okay, are you understanding that? Since I had given you that gram negative infection is there, so you have to give some drug that works for gram negative. That's why the answer will be astrionam. अगर आपको ये सब भी नहीं आता था, gram negative, gram positive, at least you should have remembered. I had given you this concept in my classes also, that if you're having beta lactam allergy, we will give something called monobactam, example of which is astrionam. Okay, so that's it. If gram positive was there, you should have chosen vancomycin. Okay, if gram positive was there, then we could have gone for vancomycin. But I clearly mentioned gram negative there. Okay. A patient was accidentally given excess rocuronium drug while preparing the patient for surgery. Which of the following is used to reverse its effects? All right, so I hope you guys got this correct. Sir, rocuronium, it is a skeletal muscle relaxant drug. Okay, NM blockers, it's a skeletal muscle relaxant drugs. As you know, they're given before surgeries to relax the skeletal muscles, especially during tracheal intubations, etc. So now the question is, skeletal muscles must be excessively relaxed because he was given more dose. Excess dose was given. That's why the muscles are relaxed. So what is the aim right now to contract the muscles again? So we need an antidote. We need one antidote in this. And you must remember the antidote that we are going to use, it goes by the name of Sugamadex. Okay. Now let's make sure we all remember this. There are two drugs. One is vecuronium and rocuronium. Vecuronium and rocuronium. Only for these two drugs we can use Sugamadex. Okay. So vecuronium or rocuronium, we can use Sugamadex. But overall antidote for all this curonium type of drugs, it is neostigmine. Okay, it is going to be neostigmine. I did not ask you overall drug. I have just given you, one specific drug. Maybe most of you already know curium. Curium toxicity is treated by neostigmine. Now, very specific is vecuronium or rocuronium. They can be treated by Sugamadex. Okay. Hopefully it is clear to all of you. Now, sir, something from OBG. A 31-year-old multi-gravida woman at 31 weeks of gestation presented to emergency with preterm labor. Which of the following is best option to fasten the lung maturity to prevent infant respiratory distress syndrome, IRDS? You all know that if you are delivering a baby before 34 weeks, the lungs may not be matured. And if the lungs are not matured, there can be a disease like respiratory distress syndrome. Okay, so what is the correct answer? The correct answer to this will be option number B. Okay. Now you must remember one or two things here. Total dose you want to give. Total dose you want to give is 24 mg in 48 hours. मतलब 2 दिन के अंदर, in 2 days you have to give total 24 mg, whichever drug you use, whichever drug you will use. Okay, so there are actually two drugs that can be used in this. One of them is called betamethasone, another is called dexamethasone. Beta is more potent. Okay. Now, if you're talking about this, betamethasone will be given 12 mg. 12 mg. Now, if I'm giving 12 mg, then how many doses I need to give for 24? 2 doses. 2 doses. So I'll give it once in a day. I'm going to give it once in a day. So how many doses altogether I'll give? 2 doses of 12 mg each. ठीक है. D is the second letter. तो 2 डोज दिए जाएंगे. Next is Dexa. Dexamethasone 6 mg has to be given. अब now you tell me this. 6 mg if I'm giving, how many doses should I give for total 24? I need to give 4 doses. I need to give the 4 doses. Here 2 doses, here 4 doses. D is the fourth letter. D is the fourth letter. Now, if I have to give 4 doses in 2 days, how should you dose? Once in 12 hours. Once in 12 hours. Okay, are you understanding that? This will be given in every 12 hour, matlab Q 12 hourly, and this will be given Q 24 hours. Are you all clear with all of this? ठीक है, एक बार फिर से, let's repeat. Betamethasone, B is the second word, so 2 doses are given. If you have to give total 24 mg, 2 बार देना है, तो how will you divide it? 12 mg, 12 mg. And if you're giving 12 mg, 12 mg, they should be given, every 24 hours. Next, second thing, is dexamethasone. Dexamethasone is D for 4. That is 4 doses has to be given. Total 24 chahiye. 4 dose mein divide 24. 6 mg each. So if you're giving this 4 doses in 2 days, how will you divide half day? Na? 12 hours mein you have to give this. All right. So that's all about that. Now if you check this out, what did we say? Dexamethasone 6 mg we are giving. 6 mg we are giving. Next 4 doses, 4 doses every 12 hour, every 12 hour. Okay, so ho gaya. Everybody must have understood. This is a very high yield topic. That's what I wanted to give you. Hopefully these mnemonics etc. that I'm sharing will help you remember in case you had not memorized this earlier. ठीक है sir. Next thing. What is the mechanism of the drug that is involved in the Samter's triad? Okay, what is the mechanism of the drug that is involved in the Samter's triad? So that's up. Hope you guys got the answer by now. Samter's triad. I hope you are liking the integration that is happening here. We are connecting to different subjects. This is the aim. Let them ask them question from here and there. We should be ready to answer. Okay. Many of you are giving the correct answer. Happy for that. सबसे पहले, what is Samter's triad? Now let us change the spelling little bit. We will remember Santer's triad. Okay, we are going to remember Santer's triad. Now we will take the Santer's triad mnemonic like this. S for salicylate drug. Salicylate drug called as aspirin. Next, A for asthma that happens in these patients. A for asthma that will happen in these patients. And the N will stand for nasal polyps. Nasal polyps. तो सबसे पहले हमने Santer's triad सीख लिया. So technically what is happening is this is causing asthma, right? Use of aspirin can cause asthma. In fact, nowadays it's given a new name. This is called as AERD. Just like we know GERD, that is GERD. Same way there is a word called AERD. What does it stand for is aspirin induced respiratory disease. Okay, respiratory disease. So now that you know the drug called aspirin is involved in this, I just asked you what is the mechanism of aspirin. Aspirin is a NSAID. Aspirin is a NSAID. So you must remember NSAIDs work by blocking which enzyme? COX. COX inhibitor. Aspirin is a COX inhibitor. But if you see this guy, that is xanthine oxidase inhibitor, those are drugs we use in gout. Drugs like allopurinol or febuxostat, they are xanthine oxidase inhibitor. Dihydrofolate reductase inhibitor is methotrexate. Methotrexate is a DHFR inhibitor. BNP analog is a drug used in heart failure. It is niseretide. Niseretide. That's the medicine that is BNP analog. Okay. So that's it, sir. आपको Samter's triad का question पूछा है मैंने, and I hope you guys got this correct. It's not a very difficult question. So with this, our session for today finishes, my friends. I hope, irrespective whatever you got from this, it doesn't matter. Do one thing. You might be doing well, you might be doing not so well, irrespective. The main goal, the main aim is to throw the information that we have learned in the exam hall. That day you should be able to reproduce the information. Today what happens in your GTs, will not matter much. You may think, sir, if I'm taking a GT, my score will come less and my morale will go down, I will not study, something like this. But trust me, my friends, if you're putting a curtain in front of the problem doesn't get solved. You have to face the problem. जितने लोग ये एग्जाम पास होते हैं, everybody goes through this transitional period, which is all the difficult one. See, without having the difficulties, how are we expecting to pass this exam? If this was such an easy exam and you will be just a doctor just like that, then people will not call you Daksab with that respect. So we have to earn that. We have to earn that. Obviously, blood, sweat, everything we need to sacrifice. Sacrifice आपने अब तक की है. So now is the time, if you're giving up, saying that, sir, I am tired, and it will happen to most of us. This is the period where we might reach fatigue also. But you have to tell yourself that your dreams, your goals are much bigger than your fatigue right now. So, Doctor Saab, feel hota hai कि I don't want to study anymore. Sir, today my day got wasted. I was not able to study. Now, don't think about this one day that you wasted today and waste even tomorrow. आज हो गया, waste हो गया. You can't bring back time. But tomorrow at least do something. If you have worked hard for the last 3-4 months and you're not doing well in the last 1 month, that means all that efforts will go waste. Do not do that to yourself. You don't deserve this. If your brain is telling you something negative, if you're not able to focus on studies, do some MCQs that time. Let's not waste our time. Let's do some MCQs. Maybe your brain can come back because there is some challenging questions that are coming there. So do something or the other, but do not waste too much time right now. Now time is money. Ye last moments pe whatever you study, it's all good. Do not try any new sources anymore. Whatever your notes are, study only those. Now, sir, let's understand one thing. Many of us will get this feeling of incomplete preparation. We'll be like, sir, ye chhoot gaya, this subject is not that strong, that is not. Forget it. On the day of exam, let's say a question does not come from those topics which you did not study. That means it's your luck and it's as good as you had studied that subject. Are you understanding that? And let's say from those topics that you studied, question aa gaya. So it's as good as studying that full subject only. You may have left some topics, it's okay. Now, don't worry about this. Pressure lene se, is this going to change anything? Of course, it's not. It's going to stay the same, na? But pressure, if you're taking again and again, if you keep thinking like that, then that means you will not be able to focus on anything as such. We don't want to screw up. Sometimes, as I always tell you, like you have to tell your heart that all is well, all is well. If you do that, if you tell your brain that it's going to be okay, whatever it is, I'm going to face that challenge. What worse can happen? Now, I'm not at all trying to tell you that become a lazy person, become loose and let it go, next attempt you can do. I'm not at all saying that. I'm saying worst come worse. If you have worked hard, let's say you could not make it, right? Trust somebody who's sitting up there. God will give you something in return which is going to be good. I know it's easier said than done. You will say, sir, for you it's very easy to say. But trust me, my friends, we all have our destinies that are planned. And whenever your time comes, you're going to do it. But mehnat karna apna kaam hai. We have to work hard. That means when you have given that exam, let's say, even if you don't pass it, you should have this content in the heart that yes, I had given my best shot. I did not leave something that I was expected to. If you're getting that feeling that yes, almost things, PYTs I did. Yes, I did not study every notes, every line by line. I may not know everything. Nobody knows that. But I had done PYTs properly. The questions which are more repeated, our faculties kept telling us that you should do PYTs properly, read that full topic. Yes, I have read the PYTs properly. I have done a certain amount of questions that faculties told us. If you have done these things, then you should have a content in your heart कि ठीक है जो हुआ whatever may happen now that cannot be changed, but yes next time तो मेरा कर ही लूँगा, I will be done. But sir, if you are just attempting for the sake, you're not doing the things properly and you're expecting to pass, then I think God will be unfair to those people who are working hard. अगर आप बिना मेहनत के एक्सपेक्ट कर रहे हो कि पास हो जाएंगे just like that based on luck, then I think that becomes unfair to those people who are actually working hard. So sir, we all will stand there. Let's hope we all pass together. Let's not be selfish. Anybody who is going to be there, अपने दोस्त होंगे, somebody who's feeling down etc., 2 मिनट बात कर लो एक दूसरे से. Sometimes it's difficult to even speak to our parents at this point. Maybe they will understand, maybe they will not understand us. It all depends. Agar your family is understanding, speak to them. अच्छा लगेगा. You will feel that somebody is there with me. My family is always there with me. If not, dost hai. Speak to them for 5 minutes. Not much more than that, but get back to studies. You have to tell yourself, this is the most important thing happening in my life right now. It changes everything. I am going to do it, irrespective how the exam will come. ये चीज़ अपने आप में बिठा लो and you guys will do it. I have strong faith in you. It's just every batch will go through this. You are not any different. Tomorrow you'll be sitting, looking back and smiling at this. And I hope you will come back to this video and say, or on my other videos and say, sir, you said to watch these things, we watched it, and in the real exam we saw those questions. You can see my other recall sessions also. एक बार देख लो क्या क्या questions आए थे. Those topics, read them well. Even if you have not done pharma well, अभी कर लो. At least these 25 important topics, do them well and you should be fine. You should be fine. Okay, I hope you're all understanding that. हो जाएगा. Make sure those topics what I'm explaining in this videos, at least उनको ढंग से पढ़ लो. Even if you are very bad in pharma, you can at least do that. कुछ तो हो ही जाएगा ना. Let's not leave it fully. And for those who are already doing decently, चलो फिर से एक बार वीडियो देख लेना 2x speed पे and you should be doing well. ठीक है? Now I will be waiting for your messages. I will be waiting for your comments down there that yes, today you got to learn something and hopefully these things will turn, show up in your exam. उम्मीद यही है. So, बाकी, I'm just looking at your texts. Dr. Rando talks, कोशिश करना है, बस अपना काम यही है. Dr. Rana Prem, sure we'll meet after exam, my friends. बाकी, what else? Dr. Venkatesh Murthy, see how to remember the mechanism of a drug. See, first of all, you should know what is the disease we are talking about. For example, urinary incontinence. You should know urinary incontinence means there is too much urination. So my aim is to reduce urination. अब आपने पहले ड्रग का नाम रट लिया, you have memorized the name of the drug. Now what you should do is that mechanism. How are we reducing urination? You should know some body's mechanism, like for example, parasympathetic system increases urination. So if you reduce parasympathetic, urination goes down. And as you question yourself, it will become clearer. And everything comes in at least 3-4 readings. Pharma especially will require more readings because this is that subject that makes you think. It's not just a story that you just by heart like that. Right? Agonist, blocker, etc. So it comes obviously with more readings. And see, ANS chapter has too many receptors, agonists, blockers, then it may seem a little difficult. Remaining chapters may you're not having too many mechanisms. They're not that bad if you see the other chapters. कहाँ पर आएंगे so many drugs? It's in the ANS. That's why I've always told you ANS should be read well. Okay, so this is it. I guess it's time to say goodbye. Doctors, for the microbiology, obviously you should be requesting the team and probably the sir would take that session for you. Baki nahi to please watch my previous session videos. That should be okay. All right. Take care. Thank you so much, everyone. Thank you for joining in. Take care, and I hope to see your text that this session was actually helpful for you all. God bless you.